Welcome to CityWise. I'm your host, Tiana Stephens. CityWise is produced by the City of Rochester to shine a spotlight on city living at its best, and that includes information to help keep you healthy and informed. Last year, nearly 200 children were reported with lead paint poisoning in Monroe County. The results can be irreversible brain damage, learning disabilities, behavioral challenges, and lifelong health deficits. While lead paint poisoning is untreatable, it's almost entirely preventable, and that's the goal of the Coalition to Prevent Lead Poisoning. We're joined by Elizabeth McDade, Program Manager of the Coalition, and Len Merritt, Lead Paint Program Coordinator at the City of Rochester. Thanks for joining us today.
Thank you.
So Elizabeth, this coalition is made up of more than 100 individuals, community organizations. How did this all get started?
The Coalition to Prevent Lead Poisoning was formed in about 15 years ago, I think, yes, at this point. And it really came out of an educator. Ralph Spezio, who was the former Coalition chair, was a principal at school number 17. Noticed that a number of the children that he had in special ed classes, he got their health records and saw that they had elevated blood lead levels. He worked with community groups, et cetera, to sort of do a pilot program in that neighborhood where they tested homes. They worked with the University of Rochester, medical professionals, et cetera, environmental health scientists, et cetera, to really look at was the environment causing this, and they found that it was. That sort of provided the opportunity to create a sort of a clarion call to the community. And so in 2004, we had a lead summit where we got over 500 community members from all aspects, all parts of the community, many representatives from local government, et cetera, to really come together in an educational capacity to learn about what this was, what could be done, and to decide to actually address it and to make that commitment to, as a community, address that using best practices and working collaboratively.
And Len, what's your background and what do you do with the City of Rochester?
Well, as you mentioned earlier, I'm the Lead Paint Program Coordinator, which is the title that supervises all of the lead testing, the collaboration between the multiple agencies that we have, including the Coalition to Prevent Lead Poisoning, the Monroe County Health Department, many of the auxiliary agencies out there, such as Action for a Better Community, NeighborWorks, and also the risk assessment firms, which provide clearance testing in the City of Rochester for different programs, grants. All of that's coordinated through our office.
And what are what's behind this effort with the city? Can you tell us about the ordinance?
Well, the ordinance came into existence, as Elizabeth mentioned earlier, as a collaborative effort by a multitude of people who were just incensed that something wasn't being done to prevent lead poisoning, such an easy, preventable process that no one was at arms about this. And in 2004, City Council mandated that this was going to change, and the ordinance came into effect, but did not go into existence until 2006. So in 2006, the Auxiliary Department, which is under Inspections and Compliance, and the Department of Neighborhood and Business Development, a lot of terms, titles there, but it operates out of that department, which ensures that our inspectors, during the course of any type of inspection, anywhere for any property in the City of Rochester, will do a visual inspection to ensure that there is no deteriorated paint, and if it is, use the ordinance as we have it and the regulations to remediate it and to make that property lead safe.
What are some of the symptoms of lead paint poisoning?
I just actually want to, one of the nice things about the ordinance is that it really is a right of every citizen in Rochester to live in lead-safe housing as a result of the ordinance.
That's correct.
And it's really important to make sure that everybody knows that they can call the city and request a free inspection, whether you're a homeowner or a tenant. And it's a really great tool to make sure that we're living in lead-safe housing. And the city does an incredible job in terms of responding to all of that. And over the 8 years, how many units have been inspected?
Well, we've inspected a little over 73,000 structures, And within those structures, there are a little over 115,000 different units. That's anywhere from a single-family home to a one-bedroom apartment that we've inspected. Out of that, we've tested well over almost 30,000 of those units to date, and we have data for that, which you can find on the city's website. Most of those properties are in our high-risk area, but as Elizabeth said, if you call the city, if you're a homeowner or a tenant anywhere in the city of Rochester, if we have not tested that property within the last 3 years, we'll come out and do that for you.
And that's the 428 lead, or
428
there's always 311.
Yes.
Okay. Elizabeth, what should parents look for in terms of symptoms of lead paint poisoning?
Well, let's see. Hyperactivity, attention deficit, maybe some sleeplessness. Does that sound like every 3 or 4 year old you know? And that's the problem with lead poisoning, is that it's not really symptomatic. The only way you can identify whether or not a child has been lead poisoned is by getting a blood test at your medical care provider. There's a New York state law that's been in place for well before the coalition was established that states that every child at ages 1 and again at 2, regardless of presumed risk, get a blood test. There are lots of reasons why we're not at 100% compliance for that, but even though Monroe County is far and above and beyond doing a great job in terms of testing kids, in terms of if you compare us to other communities, we're still at only about 65% of 1-year-olds and about 25% of 2-year-olds. And the reason it's so important to make sure you get the second test, if the child tests low or 0 when they're 1, is because, of course, between 1 and 2, what does the baby start doing? Everything goes in the baby's mouth, and they really start exploring their world. And with lead paint in particular, we're talking about where it can be found in friction surfaces in older homes. So opening and closing windows, opening and closing doors, walking across painted porches, up and down painted steps. That stuff comes in on your shoes or is on your shoes. And lead, because even though it's microscopic and it's dust, it still has a weight to it. So if you're opening and closing windows, the dust is falling onto the floor between the window and the floor, and of course that's where baby is spending all of its time. So we want to make sure that parents are proactively requesting lead tests. If you think your child has been exposed to lead or has been in a place where there could be a hazard, request a blood test from your doctor. There are 2 different tests you can get. One is called a venous, which is where they're actually drawing blood from the vein, and then there's a finger stick. Now, a lot of parents, they defer to getting the finger stick because they think it's less invasive. Maybe the child's been at a well child visit and there's a lot going on, etc. But if the finger stick comes back, the finger stick is not the conclusive test. If the finger stick comes back elevated, they're going to do a blood draw anyway. So we always try to suggest, if parents can stand the drama, to get the venous blood draw to make sure that they can actually tell if the child's been lead poisoned.
And should people try to clean up lead at home? Is there a test that they can do at home? Is that recommended?
No.
No, and we want to make this clear because a lot of folks still do that. There are products sold at some of the major home improvement stores that will detect lead in paint. The thing that we're looking for is the amount of lead. Because EPA and HUD sets the levels by which those standards have to be achieved when a test is performed, it does not give those test kits that they get from home improvement stores won't tell them that. Secondly, which is more important than anything else, the test kits will only test the top layer of paint on that particular component or surface. And with our test, and also with the X-ray fluorescent guns, if there's 50 coats of paint, we can tell you if that first coat of paint is leaded. And therefore, if a chair bumps into the wall and disturbs that coat of paint, or if you're doing some remodeling around your home, whether or not you've created some lead dust, our test will tell that for you.
And you make a good point, because a lot of times people think, my house looks fine, the paint's not chipping, there's nothing peeling. That's not the problem. The problem is, where is there friction? And when I bought my house, which was built in the 1920s near East High School, beautifully maintained home, gorgeous. but there were several layers of paint, and it was that first layer of paint when you're opening and closing the windows that creates the dust. And those. And the other thing also with the ones you can buy in those home improvement centers is they're not 100% conclusive.
No.
They can give you a false positive, or they can give you a false negative.
Okay.
So in either case, not a good thing. You know, you want to make sure that you get the right information that enables you to be able to respond in a manner that keeps your family safe.
And the second part of that question is to clean it up.
Yeah.
The important thing that we want to hit home with is that lead has a very specific cleaning protocol. It's not the same thing that you can do when you're washing dishes or mopping your floors, which is a good thing, but you need a special type of product. Doesn't cost any more, doesn't require any additional effort. The thing that we want folks to understand is that you have to use all-purpose cleaner, and that you have to change the water several times when you're cleaning it, so that you're ensuring that every time whatever it is that you're cleaning, the windows or the floors, that you're actually getting that lead dust up and not leaving it there as a streaky surface, so residual dust, so that it dries up and then you have the same problem there. And that's what we see oftentimes when folks tell us, oh yeah, I've cleaned up, but
and they may also, for example, use a home vacuum cleaner or a dustpan and brush, and that actually makes the problem worse. You do not want to be sending dust out into the air, and I don't care what kind of vacuum. I mean, you can get what's called a HEPA vacuum cleaner, and that will do it, but most people don't have a HEPA vacuum cleaner. And if it's like anything like the old junky vacuum cleaner I have, it just vacuums up dust from one side and sends it out the other end. So you don't want to do that. You want to make sure that you are cleaning appropriately, and working wet is always really the way to go when you're working with dust.
And as far as home improvement goes, what are the tips that you have for homeowners when taking on a project?
Well, I'll add a couple of things. So one of the things I always like to remind people is that lead is like asbestos. It's not a problem until you disturb it. The other thing that's always also kind of scary to know is that in 2006, 2007, 14% of the kids who were lead poisoned in New York State were as a result of home renovation projects done improperly. And the other thing that's also scary to know is that all it takes is a sugar packet of dust to contaminate a home. So somebody could, and lead paint was used not only in exteriors with windows and doors and porches, it was also used in high traffic areas. So in my house, the bathroom and the kitchen, the interiors are painted with lead paint, which makes sense because it was water resistant and high traffic areas. But if you're going to do renovation in those homes, which a lot of us do when we buy these beautiful homes that we have here in upstate New York, a lot of us will go in and start doing that, and you can actually create a lead hazard where there wasn't one simply by knocking a wall down without getting it tested. And you can lead poison your own children.
And
I think, and to piggyback on what Elizabeth said, most people who do home improvement products want to stand back and look at it at the end of it and say, oh, what a wonderful job I've done. It looks wonderful, and invite people over and have the whole 9 yards. But very seldom do they include the entire process of that home improvement, which includes the cleanup. Very few people will do the cleanup that is necessary to ensure no hazards are left behind. If you pick up nails, if you pick up all of the paint products that you've used, if you pick up, any glass that may have been associated with that, then do the rest of it. Don't assume that that process is complete unless you've done the actual cleanup that is required when that home improvement project is done. And there are a bevy of training providers out there who can give you that class, show you how it's done. You can go online, you can go on the city's website. We have a plethora of information on there. The Lead Coalition has the same thing, and we provide all of this to the public so that you have some peace of mind when that project is completed.
We also have, in Monroe County, so in the Monroe County Department of Public Health, and again, it's everybody all working together. We all work together all the time. They have a grant where they provide free classes that's called Renovation, Repair, and Painting. There's a federal law. So in 2010, in addition to everything else that we've got going on in here, the Environmental Protection Agency passed the Renovation, Repair, and Painting rule. which requires that anybody who is receiving compensation, and rent can be considered compensation, for work that's being done in a pre-1978 structure that disturbs 6 square feet on an interior or 20 square feet on an exterior, has got to be newly certified in RRP. So that could be, you know, if you're a landlord and you own a double and you're doing the work yourself next door, you have got to be certified. HVAC, plumbing, electricians, painting, anybody who's, it's not about the job description, it's about what's being, it's about the square footage that's being disturbed and if it's a painted surface.
Okay.
Luckily in Monroe County, we actually have free classes. So you can sign up, go and get certified for free. And in other communities, it actually costs several $100s to get that training.
Right.
And learn how to do it. Homeowners can take this as well. I mean, it's one of those things where if you think you've got an older home and you want to do some renovation, sign up for this free class. It's a full day, but you learn how to work safely.
Okay.
In addition to that, you should make sure that if you're going to be hiring anybody to do renovation work, that they've also got to be RRP certified, that they've got to show you their new certification that says that they've taken the training, that they understand that there might be a lead hazard here, and that they are going to work lead safely. And of course, you know, it's always great that if you actually have some idea of what that looks like, you can, you know, Google and look at YouTube and so forth, so that you're an educated consumer to understand if they're going to be working lead safely. What does that mean, and what does that look like?
Now, are adults at risk as well?
Yes, you know, and we actually didn't talk a little bit about like what it can actually do to kids. So, and I'll talk about some of the I'll do both if that's okay.
Sure.
So with children, we're talking about permanent brain damage. Lead is like, our bodies cannot differentiate between lead and calcium, oddly enough. And also, by the way, I'm not a doctor, and nor are you. So if you have some other additional concerns about this, you should talk to your caregiver. But our bodies cannot differentiate between lead and calcium. Our brains, our synapses need calcium to develop and to grow. So if you see those tree branches, right? This is what synapses look like. They look like tree branches that are growing together. Lead actually stunts the growth in the tree branches. So the synapses never actually connect. They never grow to be able to connect. So before children even get into school, you're talking about lifelong learning disabilities, auditory issues, IQ, etc., attention, etc. It also impacts your decision-making center of your brain. So children who are lead poisoned are more likely to engage in risky behavior. Children who are lead poisoned are more likely to drop out of high school, become incarcerated, all kinds of things that, you know. And then with adults, we're looking at, because it is a neurotoxin, so it enters our body through dust. It goes into our body, gets into our bloodstream, and that's how you measure it, is with the blood test. But it eventually moves out of our bloodstream into our fatty tissues, our organs, our muscles, and then eventually settles in our bones. So every exposure is cumulative and permanent. With adults, because it is a neurotoxin, you can see lifelong health deficits that include correlations between lead poisoning and high blood pressure, kidney damage, sexual dysfunction. There's a whole litany of things that go on. And currently, they're doing studies at the U of R to look to see if there's a correlation between lead poisoning and Alzheimer's. And they think that one of the questions, or one of the things may be that as we get older and our bones, if lead has moved into our bones and is in our bones, as we get older and our bones are softening, is the lead being re-released into our bodies, and is that impairing cognitive function? So it is something that affects every single person.
And you have some literature that you brought with you on your lap. Community outreach is so important on this one. And tell us about what the Coalition is doing.
Well, the Coalition to Prevent Lead Poisoning has always been an education and advocacy organization. We work with all of our community partners, but we have created educational materials. We currently have, this is our basic lead poisoning prevention brochure, but we have them in 7 languages. So, and I don't actually read all these languages, but we did have them printed, what they are in the back. So I'm not, this is not magic. So this one's English, this one's Spanish. We have Swahili, Nepali, Somali, Karen, and Burmese.
Wow.
And basically what it does is it gives you, I'm not going to read the Spanish one because I speak Italian, which we don't have here. It gives you all information. So the City of Rochester's information is here, our information is here, the county's information is here. It gives you some basic information about the RRP rule and what you're going to do if you're going to hire somebody, what it could possibly do to you. Make sure it talks about the making sure all children get tested, etc. So we really try to make it be a very kind of brief, quick overview, and we did get them in 7 languages because we have lots of new community members that are coming from lots of different countries. countries, and certainly some cultural practices are different than we might be expecting in our country, and so we want to make sure everybody knows that they've got what they can do to make sure their children are not getting poisoned.
And all of that information is validated too. It's not something we've thought up and trying to impress people with our knowledge or background, but it's something that comes directly from years and years and years of research.
It's everything is evidence-based. I mean, I think the strength of the coalition, and I mean, so the city of Rochester has seen a reduction in the number of children who are lead poisoned over the past 10 years of over 80%.
Wow.
And the lead ordinance is one that is held up as a national model. I mean, we, and by we, I mean the collective we, our coalition, the city, the county, everybody gets phone calls from communities across the country, and I'm not exaggerating, saying, how did you do this? What did you do? Can we get your brochures? Can we get your and you know, how can we actually work to do all of this, and all of these different parts and pieces, and making sure that our community members are educated, and making sure that people understand what they need to do, and that it's not as prohibitively expensive as you might think it is, and that there are things you can do as an individual. There are resources that you can access. There's really no reason that we are finding a child lead poisoned in this community. But certainly the facts and figures and the statistics prove that what we're doing is working, and that's what's really so important.
Right, you've made a lot of headway. The coalition has, and we're so grateful for that. Finally, what's the next step? What do you want to see happen next in Rochester?
Well, if I may.
No, go right ahead.
Well, I think what we want to see is no child being lead poisoned. I think Elizabeth mentioned that earlier. We have a tremendous amount of work ahead of us. Even though we've made great strides over the last 8 years, and the successes there, and it's seen around the country, we have a lot of work to do. Again, I'm not certain how anyone feels about numbers. I don't look at averages. I don't want to say the majority of. I don't want to think about, well, it's just a few. I would like to see zero. So our effort, our level of commitment to ensuring that children are not lead poisoned will continue at the City of Rochester, and I'm sure with the rest of our partners that are involved in lead poisoning prevention. We're not done. We're happy to be on the front lines. We want to make this the center of the universe when it comes to how to prevent lead poisoning. Rochester is on the map. We're constantly bombarded by phone calls, agencies, people. How do you do it? What can we do? How can we mimic? Can we take a part of it and use it? What can we do? Because we want to do the same things. You guys are successful. You've tried this. You know what works. You know what don't work. What can we do? So Rochester is going to continue that pace. We're not going to step back and say, okay, we've gotten to a point that's below 200 now, we can relax a little bit. Not on our part.
And I just want to pipe in a little bit, saying, we had nearly 200 children were reported with lead paint poisoning last year. We know we haven't identified all of the children, and 200 is 10 kindergarten classes. So if we maintain the status quo, that's going to be 10 kindergarten classes every single year in the school system. Is that okay? It's not. If it's your child, it's not appropriate. And so we really, we echo all of that. Zero is what we want to see.
Thank you guys so much for your time today. A wealth of knowledge, and all of that information, again, is on the website, the Coalition to Prevent Lead Paint Poisoning. You can call them at 224-3125 or visit letsmakeleadhistory.org. Thanks for joining us on this edition of CityWise. I'm Tiana Stephens, and we'll see you next week.
you.